Hi, welcome to the Comprehensive U.S. Healthcare System online course for Non-US IMG. My name is Julius Haryadi. I'm an internal medicine physician working here in the U.S. I've been working in the U.S. for almost 8 years now, 3 years being a resident, 5 years, almost 5 years when I create this video, being an attending. And I'm passionate in helping non-US IMG to match. And then in this video series is going to be a new video series. I create the Epic EMR ambulatory video series in YouTube before, and then now I'm creating, and I've been wanting to create this comprehensive online course for non-US IMG talking about the U.S. healthcare system. And this whole course, just like the Epic Ambulatory series, will be available for free in YouTube, and there are going to be multiple series and multiple parts of it because it's going to be very, very long. I plan to cover everything so you will understand about the healthcare system as a whole. Now, one of the reasons why I create this course is because there's a lot of misunderstanding out there. If you Google about explanation about U.S. healthcare system, or you would like to learn about U.S. healthcare system, you're a foreigner, you're foreign graduates, you try to get into the US, you try to understand how the system works, they all talk about insurance. They talk all about payers, reimbursement, and then federal or commercial insurance, Medicare, Medicaid, how do you get money, and what are the services that's provided, how do they pay the providers, how do they pay the hospital. Guess what? US clinicians, even though yes, that's important for you to understand, but that's not the part that you want to actually understand, because the job for us being a clinician is to take care of our patients. So I designed this course specifically for non-US IMG. So for somebody who is not familiar with the healthcare system at all, I was like that. Like, I'm a non-US IMG. I'm originally from Indonesia, so I don't know nothing about the healthcare system. But now I've been practicing for 8 years, so I know pretty much in and out. I mean, I would say I would know enough, way more than you do, since you haven't come here, right? Now I'm gonna design the course and explain the course looking from the clinician perspective. Okay, so the job for clinician is to take care of your patients. So if you just want to take care of your patients, you don't actually need to know all the nitty-gritty details about the insurance. You just need to know enough understanding about the insurance so you can take care of your patients. Okay, the goal of the course is that so you know how to take care of your patients inside the U.S. healthcare system. When somebody has done like a lot of observerships or externships, whatever, U.S. clinical experience for months, or especially if somebody has done the first years of being an intern PGY1 in the U.S., then they would usually say, now I understand how the system works. Okay, now I can work within the system. What they actually mean is, now I actually understand about the resources and how to use that resources to take care of your patients. Yes, so the U.S. healthcare system, and I've been telling this over and over again, I put it in LinkedIn, I have created previous videos just for a basic introduction about the healthcare system, and I actually have a PDF related to that, so you can actually download the PDF and actually will explain all about the U.S. healthcare system as well. This is basically the video form of it, because it's kind of painful to read the PDF. You don't understand the context of what's actually going on, but that is still a great resources. You can use the link down description below, and you can download about the PDF of the healthcare, and then also about the Epic EMR. Yes, I create the video series of the Epic Ambulatory series, but there is an inpatient EMR as well. It's kind of the healthcare system and the EMR kind of goes hand in hand. Is something that the non-US IMG really needs to adapt. So I created a webinar for that as well, how to review chart like a top intern even before your first USCE using the Epic EMR. And actually pretty much applies to a lot of EMR out there. So you can use the link down in the description below, and then you can check it out. It's just completely free. Okay, now let's get back to this. Basically, the idea of healthcare system from the clinician perspective is to understand about what are the resources and how to utilize the resources to take care of your patients. It's not anything to about insurance. Insurance is a small part of the healthcare system as a whole, things that you need to understand in order for you to take care of the patients. Okay, now, so how we gonna approach this? This is how we're going to approach it. So the U.S. healthcare system, I divided by three, I would say, U.S. healthcare resources divided by three categories: the human resources, the facilities, which is more like a physical type of locations, okay, and the agencies or groups. I'm gonna give you a list of the examples here. So in the inpatient, right, the human resources, who are the human resources? Gonna be the hospitalists, gonna be the consultants or specialists like the cardiologists, nephrologists, on and so forth. Physical therapist, occupational therapist, social worker, case manager. You see there is a lot of people. Social worker, case manager, the nurses, the APRN, the LNA, the physician assistant, the nursing supervisor, the respiratory therapist. There are still more. I'm just listing here to show there are a lot of people inside the hospital that has become resources that can help you take care of your patients. I won't be able to list everything here, but I promise you we're gonna go through all of them. I'm going to explain all of them, and you're going to understand their clinical roles, when you should call them, what are the information they can give you, how can they help you take care of your patients, and how they interact between one person to another person, and how they can work together and help your patients. Now in the facilities, okay, these are, like I said, it's more like a physical locations. The ED is part of facilities. Inside the ED, there is usually a trauma bay. There's a telemetry unit. There's a step-down unit, medical ICU, surgical ICU. There's specialized ICU as well, like cardiac ICU. And for a floor, there are some academic hospital that sometimes have a special subspecialties floor. For example, oncology floor. So understanding this helps you not only understand the system, but also when you applying for the residency, it would be useful for you to know, hey, I'm interested in your program because you have an oncology floor, for example, if you want to become a hematologist oncologist. So you see, as you understand the system, you understand what you're looking for, and you understand what you're looking for inside a program. You can research the program better. You can try to fit into the program as well. So understanding the system also help you in the match process as well. So then we have the labor and delivery unit. So these are pretty much about the same as in your home country, right? But the one that is quite unique here would be the discharge facilities, because in the US we have a lot of discharge facilities. We have acute rehab, subacute rehab, skilled nursing home, long-term acute care hospital. There are actually more. I'm just listing some of these, and it can be very confusing for people who start, because they're also going to use the acronyms, right? Yeah, LTAC, SNF. So you're going to get confused when you're doing rotations. What are these doctors talking about? Yeah, he's going to SNF. Or, yeah, we're going to transfer into LTAC. Like, they're not very friendly to a non-US IMG who is not actually understand all the acronyms. Forget the acronyms. Even if they explain to you about long-term acute care hospital, you don't even know what that is. So that's the goal of the course. I would like to explain to you, because understanding the facilities is also part of the resource, also the way you understand the system as a whole and how you can take care of your patients. Okay, and then lastly, the agencies and groups. There are groups of people in agency. Now it will make sense for you when you read the list, right? The law enforcement is included in here. Agencies, groups like law enforcement, poison control, transplant, donor networks. The insurance is part of the agencies and the groups that you have to work with if you want to take care of your patients, certainly. And then the adult and child protective services, that's included here as well. Now, what about the outpatient? The outpatients, we have the primary care provider, right? And the primary care provider can be a mid-levels, just like in the inpatients. Actually, they could be mid-levels, like the APR and the physician assistants. Of course, we have the consultants, the cardiologist, nephrologist, and all the subspecialties. But also we have the medical assistant who rooms you. We have a triage nurse. And in order to understand the triage nurse, you need to understand how the outpatient workflow is built, which I promise you I'll explain. There's an on-call nurses, there's a clinical pharmacist, and there's a clinical pharmacist in inpatient as well. And there is a care manager, and there is a lot more, of course. And in terms of facilities, we have clinic pharmacies. Like if you have come to the US, some of the brands like a CVS or Walgreens. Okay, so they are all pharmacies. They are actually part of the system, because yes, patients goes to them and then get some form of a treatment, like a shots, vaccinations, etc. There's specialty clinic, wound clinic, anti-coagulation clinic, specialties clinic, and the subspecialties clinic. Specialties clinic is like, of course, cardiology office, nephrology office, but then we have subspecialties clinic. Like, for example, it's a pulmonary hypertension clinic. Yes, we do have that, especially in the higher end of academic hospital. They specifically manage this really specialized case. And we have a dialysis center. We have partial hospitalization program, which is for psychiatry if they don't meet a full admission inpatient psychiatric admission. We can do a partial hospitalization program, for example. And these are facilities, which is a hospital. It's a physical locations. All here that I listed in facilities meant to be a physical locations that you can actually go to. And then finally, the agency use groups. There's some overlaps, of course, with the inpatients, but some of the outpatient ones are visiting nurse agency. We call that the VNA. There's an alcohol anonymous group for people who's struggling for alcohol. There's community mental health service, and these are basically, in brief, people who have a severe psychiatric disorder, or probably with a very severe disability like autism and such. They actually being taken care by the community mental health service. There is like some kind of an adult daycare program, which I will definitely explain to you more about it inside the course. And then substance use disorder clinic, like methadone clinic and such. So those are just basic overview, and this kind of like gives an idea on how we're going to approach this. So this is going to be the outline. I'm going to give the introduction. Well, basically this video is the introduction of the whole US healthcare system, because you need to understand how we approach it. We approach it based on the resources. What are the resources, and how we're going to utilize those resources, and how these resources interact to take care of the patients, right? And there will be an inpatient and outpatient each. So inpatient, human, facilities, agency. So they're going to be multiple video series. The next one after this, we're going to talk about the inpatient human, and then after that, inpatient facilities resources, and then we're going to talk about inpatient agencies resources. Then we move to the outpatients, and then we go over each of that. And then there are parts that kind of a little bit outside of this, or I try to make it more specific. These are like general hospital protocols, because you need to understand about the rapid response and the codes and how the communications inside the hospital actually work in the US, right? There is a pager system, there is a phone system. How's the workflow in terms of like call and then schedule? Like when you start, people usually start working in the morning. When do we stop working? And these are very different compared to the other countries. Well, I mean, probably there are countries that's pretty much the same, but I know for sure it's very different in my country. And then asking for, when I ask the other non-US IMG from different country, they also admit that it's very different from the other countries as well. So I will need to explain about that for you to understand how the hospital pretty much run and how the clinics actually run. So I'm going to talk about the outpatient workflows as well. We're talking about the triage. We're going to talk about the in-baskets. We're going to talk about how to handle those results, etc., and how everything works together to take care of your patients. And finally, I'm going to make a very specific topic about the insurance in the US, the federal and the commercial. We're not going to go more in specific here, like co-insurance, deductible. We probably mentioned a little bit about it, but I'm just going to, again, focus on the things that you need to know as a clinicians to take care of your patients. Okay, now, that's around the whole US healthcare system. But I figured that it's going to be boring. Okay, let's start with the hospitalist. This is the hospitalist role. This is what they do. They admit the patients, and then they put the orders at, blah, blah, blah. You know, I think that's going to be super boring. So in order to make it more exciting and more engaging, I decided to make it in form of questions. Hey, if this happened, what should we do for this patient? If that happened, what should we do for that patient? You see, so I think you will understand more if I create some form of more of a scenario, of a real life kind of like scenario of what happened to the patient and how we can use those resources to help the patients, and then I'll put the explanations about it. Okay, so let's get started. Our first questions. Mr. Alfredo, a 43-year-old Mexican immigrant who had never been seen by a doctor in the US. He has a persistent cough for the past 3 weeks. While grocery shopping at Walmart, smart. He noticed an internal medicine clinic nearby and saw, oh yeah, well there's a clinic over there. Probably I should be seen, right? And he wants to be seen by examined by physician. I want to go and see by physician today. What is the most appropriate action he should take? A, walk into the clinic, request a same-day appointment. B, call the clinic to schedule appointment for today. C, visit nearby urgent care center. D, go to the emergency room. And E, go to CVS pharmacy and find a provider that would examine him. So I would recommend you to pause, think of an answer, give me your best answer, and then once you decide your answer, you can press play to go on. All right, cool. The correct answer here is C, visit a nearby urgent care center. Visit the nearby urgent care center is the right answer. So here's the thing. In the US, outpatient is basically appointment based. You go to my office, they're all appointment based. Okay, so you cannot just walk in. That is one of the big difference. In my country, for example, I can speak most in my country, people can have as long as they are licensed for practice, they can put like even a sign in on their house, and this is Dr. Haryadi, this is my license number, and then people can just come in and then see you and then being taken care of by you, as long as they open a practice there like legally. Now it doesn't really happen that way in the US. So in the US, all of those are appointment based. So in order for you to go, if you're not established by a primary care provider, in order for you to be able to go and be seen by a doctor, you need to use some form of emergency care type of practice. So it's either urgent care or the ED visit. So here the second best answer would be the ED visit, because yes, if he goes to the emergency room, he will be seen at the same day. But the thing is that he has been having this cough for like 3 weeks. So if he has been having 3 weeks, logically speaking, we use some basic test taking strategies here. It will make more sense to not go immediately to something that a higher level of care. So it makes sense to just go to an urgent care center. Now in pharmacies does not have clinicians to actually manage the patients with complaints like this. They do have nurses or a provider that able to administer vaccines, but they cannot examine and make medical decisions, prescribe medications, and things like that. So the correct answer here would be C. Now we move on to the next question. So the same guy, Mr. Alfredo. 3 months ago, Mr. Alfredo went to urgent care and was treated with a short course of prednisone. After that, he followed the advice to find a primary care doctor, and now he has established patient at the clinic. And today, he has a fever, headache, and feels unwell. He wants to be seen by a doctor. Now what should he do? A, walk into the clinic, ask to be seen today. B, call the clinic, ask for the same day appointment. C, go to urgent care. And D, to the emergency room. So you can press pause, try to think of an answer, and then when you're ready, press play to go on. So here, the correct answer is B, call the clinic, ask for the same day appointment. So we don't typically just jump and barge in, hey, I want to see the doctor today, can you give me an appointment? It's not how commonly things work in the US. So you want to call that clinic, and then because by calling the clinic, they can be triaged if there's anything that's serious. Okay, oh, you have a fever, you have headache. Oh, let me get you into a triage nurse, so the nurse can call him and then triage him and then decide what to do next. Okay. Now, since somebody is established in the clinic, actually it is possible for him to get a same-day appointment. There is always a slot for like a same-day visit or sick visit, or they can call whatever. Basically, it's a same-day slot, open appointment that you can use. I have that as well. There is also something called the prompt care. Now, the name probably different from one institution to another. You go to a different state, it will call it differently. It's just in my institution, we call that a prompt care, meaning that there is a clinic where it's dedicated just for a same day slot or appointment. So you can actually do that and then get a same day. Now, what's the difference between that and the urgent care? Well, the urgent care is a walk-in, right? So the prompt care is appointment based, but you make the appointment that same day. That's the first difference. The second difference is the billing. You go to urgent care, it will be way more expensive. Even though you have an insurance, you still have to pay the copay, deductibles, basically they will charge you quite a lot depending on what kind of insurance you have. So some insurance will cover, I'll cover you 80% for your emergency visits. You know, they will count it as emergency visit, but in the same day they will still count it as an office visit. So it's really built differently. For something that's emergent, it will be higher. Some insurance will cover, I will cover 80%, I'll cover 60%, I'll cover 50%, you know, I cover a flat of copay of $200 flat. So it really different. It's hard to predict. It's hard to know. It depends on the insurance and depends how much premium the guy paid for that particular insurance. So it's very, very hard. Now the safest way in general would be just go to a same day a same day visit or a prom care. So because he has established the one that's before, he hasn't been established yet, so he cannot go into any same day. He will have to go to the urgent care. Hope that makes sense. Now, we move on to the next part where he calls it primary care clinic, asks for the same day, but then transferred to a triage nurse. He explained he has fever, headache, chest pain that feels unbearable, and shortness of breath. What's the most likely outcome of this conversation? A, he will be told to come to the office right away to be examined. B, he will be told to take Tylenol. The nurse will check with the doctor. Tylenol is paracetamol in the other countries. C, he will be told to go to urgent care, and D, he will be told to call 911 or go to the emergency room right away. So press pause, think of an answer. Once you're ready, press play to go on. So here the likely outcome would be D. That's the likely outcome of the conversation. The nurse will tell the patient to go to the emergency room. And the reason is because the symptoms reported to be severe. So we anticipate that's what's going to happen. If it's not as severe, he will be coming to the office and schedule a same day appointment. But yeah, here it sounds severe. So most likely the nurse is going to say that. Now choice B is he will be told to take Tylenol, and then the nurse will check with the doctor. Is a second best answer, another possible answer. If the nurse is like I don't know, maybe a beginner or some sort, then they probably just, oh, you know what, I'm not really sure if you have fever and severe shortness of breath and unbearable, you probably should go to the emergency room immediately. Maybe I should check with the doctor if that's actually a great idea. And guess what? Based on just the description, that would be the right idea. You know, so most likely outcome, like the most likely outcome, is that the nurse is gonna say go to the emergency room, call 911. Okay. So now the nurse tells Mr. Alfredo to call 911 because of the severe chest pain and shortness of breath. He then asks, well, but how much I will have to pay if I'm going to take an ambulance? What is the best response? A, ambulance rides are always free. B, the exact cost depends on your insurance. C, will cost $100 flat no matter what. And D, the clinic will cover the ambulance cost since they told you to call. Press pause, think of an answer, and then when you're ready, press play to go on. So here the correct answer obviously is B. I think a lot of you will get that. The exact cost will depend on the insurance. Ambulance cost in insurance is awful. It can be very, very expensive. It can be $1,000. If you're unlucky, your insurance doesn't really pay for it or cover very low of it, so it's still going to be quite expensive. So it is an issue, but you have to do the right thing. You know, but that would be your answer. Well, I'm not sure what's the cost going to be. Probably it's going to be expensive. I would highly recommend you call the ambulance, but the patient has the autonomy or choose whatever they actually want to do. So this is in the US, America, people have autonomy as long as they have the capacity to make decisions for themselves. Even though that decisions might not be good decisions or bad decisions, but that's you to judge, not from the patient's perspective, right? So yes, just let them know that yes, the cost of ambulance might vary, depends on the insurance. And what typically the provider do after this is to document of the conversation to make sure that they're free of liability, right? So I called the patient, told him the patient needs to go with 911. If the patient says the patient would like to think about it, you document, the patient would like to think about it. So the principle is this: if you do something, you document it. If you document it, you better do it. Yeah. So now the patient will go to the emergency room, and we will, for the next video, we will transition to the inpatient US healthcare system. I'll see you again in the next video.